painful periods, or could it be something else? Well, 1 in 10 women suffer from endometriosis. But what is this condition? How does it impact women, and how does it impact sex? Well, good night, ladies and gentlemen. Thank you for joining us for episode 3 in season 11 of JASL After Dark. I'm your host, Calvin, and we're excited to be back for candid conversations every Wednesday at 8 p.m. right here on Instagram and on TikTok. Now, JASL After Dark, of course, is brought to you by Jamaica Aid Support for Life, and we're live and we invite you to follow our pages. Now, with me is my co-host, Jamar. Jamar, wagwan.
Well, I'm there, it's a boy Jamar. The release thing, of course. And of course, Calvin, we're still celebrating International Women's Month. And so it is only fitting for us to discuss Endo and me. Open conversations about endometriosis and sex.
Yes.
And so to join us in tonight's discussion, we have Obstetrician,
Tongue twister.
Yeah.
I'm sure that tongue twister for a lot of people, right?
Most people.
Boom, have it.
Yes.
Obstetrician, gynecologist, Dr. Ryan Halsall, to tell us everything that we need to know about endometriosis and then some. All right, so welcome, doctor, of course.
Thank you guys for having me.
Yes,
Of course.
Endometriosis.
No, we can jump like just
No, just going to give a little intro. And then I'll let you go and do everything after.
Yeah.
Just for the people who may not be aware of what this endometriosis thing is.
Okay.
So, just a little science. Every month a woman would see her period. Most women.
Yeah.
And so the lining that they normally shed, we call it the endometrium. So the name endometriosis comes from that lining. And it's not the exact same tissue, but it's tissue similar to it that they find outside of the uterus.
Right.
And any woman who has that type of tissue outside, we say they have endometriosis.
So in other words, you
It comes
say-
with a lot of stuff, yeah.
So what I understand from that is the tissue that is in the uterus, so similar
Inside the
tissue,
cavity.
and you're finding that in other body parts.
Correct. In the pelvis, and it can be anywhere in the body.
Alright, I see. So you know that the conversation is going to be very informative, so we don't want you to move a muscle. But we want to get off the right way, and by that I mean dip into our hot pot. I'm kind of nervous still, but let's get into it.
Yes,
Hot
we have
pot.
a-
Hungry, who's if we eat? Are we in the pot?
It's time for Hot Pot.
Hot pot.
Hot Pot. Hot Pot.
No, sir. This
Trust and believe.
Right, so there are always some topics that are interesting and somewhat controversial. So each week we dip into our hot pot to find a topic to discuss. I'm gonna ask Doc.
Yes.
Because in fact I'm not even gonna help you.
It's
You're gonna pull off the lid.
Don't want it.
Take out one.
Take out one.
Load.
Let's hear what this is.
An Ohio mother who left her 16-month-old toddler at home for 10 days to go on vacation was recently sentenced to life in prison for murder. Do you think that is really murder, and is life sentence excessive?
Read one more time because it's so punkish.
Yeah, it does,
It's
but
so punkish.
I think I remember the story when it came out, if not last year, the year before. An Ohio mother who left her 16-month-old toddler at home for 10 days to go on vacation was recently sentenced to life in prison for murder of a 16-month-old toddler. Do you really think that it's murder? Do you really think that it's really murder, and is the life sentence excessive?
So 16 months, we don't look so good in maths, but that 12 and 4,
Almost a year and a
16,
half.
so 1 year and 4 months. And you left a 1 year and 4 month old baby to go on vacation.
Not even a home alone when I say this.
No.
Kevin was of age.
Yeah.
Kevin was of age, a month
16
and a half
months.
year old
A
baby.
year.
That's
A year and 4 months.
A year and
four.
yeah, that's crazy.
To do what?
to vacation.
So, what do you think, Doc? Do you think that that murder is the right sentence?
I guess by the letter of the law, should death the child to die. It would be similar to her having a box at home and putting the kid inside there and not feeding the kid for 10 days. So
Exactly.
essentially murder. And that is a punishment that the law puts out for first degree murder because it was premeditated,
Mhm.
like she forgot, or she didn't prove that she forgot she had a 16-month-old
Mhm.
child, and she left the kid at home for 10 days.
Yeah, Jamar, what
Like,
do you think about that?
this is just the height of carelessness. I don't even want to think, because I'm trying to think, alright, she probably has suffered from postpartum depression and all that kind of vibe. But that's a baby though. How do you get up and not remember that you have a child at home? You pack your bag for going on vacation though, so that doesn't make any sense.
Exactly, for 10
Yeah.
days.
For the postpartum depression question, Doc, I don't know if you know. A year and 4 months after, do women still experience postpartum after that long?
The duration of postpartum depression is going to vary. So at some point it now transitions from just being postpartum to full-on major depression.
Okay.
So it is entirely possible that there's a psychiatric component to this. But that's not normal behavior, and every time you see something like this, you always have to look up top. What stresses are going on, whether even drugs in play. We don't know the full story, but I don't know the full story.
Yeah, it has to be more than just carelessness, because
No, nobody's careless.
careless is
something
accidentally leaving your child in the car.
Right.
That's
We
unfortunate.
heard those stories.
But a vacation though.
For 10 days, that certainly seems like a higher level problem.
This is where we need the Lord in prayer. That's how I'm honest, and the labs to check out that situation.
But we think the life sentence was, or because it is first degree murder, there's no question about the
I mean,
sentence.
that is up for the courts to decide, obviously. They would have to prove that there's a psychiatric component for it to say, alright, not straightforward premeditation. So I don't know what the details of the case were, if they weren't able to put that forward and prove beyond a reasonable doubt that there was, you understand? So
Yeah.
that's a court decision. You have to just trust the courts that they did what they're supposed to do.
And they say, oh, why this in the United States?
Tell you what, I'm hoping that we get something
There's
also
another
hot,
hot.
but more lighthearted. So deep
It's
for us
possible,
again.
right? Deep again.
Not like the first one.
Deep again. Yeah. I hope it's something lighter. One that hot same way doing, but lighter.
Alright. It's not like that.
It's not lighter.
Come on, you never kick off right.
Well, it's after dark. So.
A news report was recently shared where skin bleaching is being blamed for low sperm count among young Jamaican men. What is your opinion on these findings? You want to read that again?
Yes,
Yeah,
sir.
we want one more time.
A news report was recently shared where skin bleaching is being blamed for low sperm count among young Jamaican men. What is your opinion on these findings?
Is that even possible to do that?
Well, what is in the bleaching cream?
So, yeah.
Right? So a lot of these bleaching creams have hormones in them, steroids. And if you're exposing the body to excess steroids that it's not supposed to be having, it can disrupt your hormonal balance, so to speak. Right? And then it can have secondary effects on fertility.
Okay, so it's not a matter of where you rub it, but what's in it and the excess
Right.
amounts that you
So if
add
you're
to-
using it, because some of these bleaching creams were used for blemishes.
Mhm.
See, if you have a 1 or 2 spots you're using it on, that's
That's
fine.
okay.
If you're rubbing your entire body, that's a large volume because the skin is probably the biggest organ in the body.
Nobody, yeah.
And so it's going to absorb a large amount of steroids. So over time, chronic use is going to.
Solar dose is facet veneno. The dose make the poison. That means everything in a certain amount. So if you have so much it will cover your whole body, that's where the issues
Exactly,
come in.
yeah.
Okay.
Yeah. Cool. Well,
Nothing?
I mean, I'm not gonna bash anybody who decides that
Mhm.
they want to apply skin lightening cream. I don't do it myself, but with this finding, I don't know. You think it's gonna change?
I think it's beyond just young sperm count. I mean, a lot of it has to do with socialization and what you perceive yourself to look like, and that's how a lot of people do it. So you're going to have a lot of men who are bleaching, who have kids, that are going to dispute this.
Right.
Yeah.
So it's going to be hard now to.
Yeah, bleach from all long and
Exactly.
see a tree you me have. Tree you me get.
You have DNA, that's another story.
Wow. Wow.
You know the jacket rate
If you
is
know,
high.
you know.
Yes,
It
yes,
is,
that
it
is
is.
true.
Right?
That is
So
true.
a lot of men have kids that you know they're not theirs. So it's going to be hard to get that stigma out. It is getting more and more ingrained in our culture, and you know through dancehall and everything. It is a big thing. So
Well, as you said, Dr. B, what's in it? It's what's in the cream for me. Because then, with what Calvin said about, you know, me disputing the fact that, oh, me have bleach and me have kids long time. When did you start to bleach? What are you using?
when did you have those kids?
Oh,
In
yeah.
your bleaching career, so to speak. Early in the
As a
bleaching
bleacher.
career.
Right. So it really depends on those factors. But of course, let us hear what are your thoughts on the two questions that were posed. Kelvin?
Yeah, we want you to share them. You can share them via the comments or send them to us via DM on Instagram and Facebook at JASL Info. Because we want to know what you think too, you know, we want to know what you think. You can also send in your questions that you want Doc to answer on this topic of endo and me. We're looking at endometriosis, and March is not only Women's Month, but it's also Endometriosis Awareness Month. And that's why we're having this conversation here to really find out. We want to remind you guys that Just After Dark is brought to you by Jamaica AIDS Support for Life, and we do provide free HIV and syphilis testing at our 3 locations in Kingston, St. Anne's Bay, and Montego Bay. So, yeah, if you don't get tested from 2024, it's time. Linkway. It's time. So, we're going to get into that conversation and talk more about endometriosis. But, Doc, for the persons who are watching and they are saying, you know, the man always in a woman thing, we are talking about endometriosis and all that. Let them know who is an obstetrician and gynecologist. Probably know the gyno part, but the OB, the OB part.
Oh, what is the OB?
Yeah.
Well, it's a joint specialty. Probably in other parts of the world they may separate them, but in Jamaica it's one program. So the obstetrician deals with pregnancy, pregnant women. They manage low risk and high risk pregnancy from conception, even from preconception to after delivery. The gynecologist deals with everything else related to women's health. We're talking more in the pelvic region. We don't do breast health in Jamaica. In other countries, gynecologists deal with breast health, but not in Jamaica.
Interesting. I didn't know that. I didn't know it, they did that anywhere. I thought China just
Gynos don't do
Yeah,
it,
right.
but no, they call it women's health condition, so they tackle everything. So it's just a difference in how the training is done and what you focus on. Out here, the general surgeons will deal with breast.
So Jamaica don't allow you to get everything in the section. So one deal with one deal with the other.
And I mean, even in America now, if you want to deal with fibroids, you're likely going to go to a fibroid specialist. And if you want to now go and do something with your ovaries, then you have to go to another specialist for that. So they're very subspecialized, even overseas.
Alright, so for the persons who are just joining, who missed when you gave that synopsis of what endometriosis is, give them a recap and tell us how does it manifest in women's bodies.
Yeah.
Alright, so endometriosis essentially is when tissue that is similar to the lining of the womb that is woman shed with each period. Tissue similar to it is present outside of the uterus. So it can be on the tubes, on the ovaries, on the pelvic floor. It can spread to the bowel, bladder. We have patients who have it in their navel, we have patients who have it in their lungs, and they can have it in their brain, in their nose. There are patients
In their brain?
Yeah, they have patients who have it in their nose, they have nosebleeds every time they see their period. Those who have it in their umbilicus, they have bleeding through their navel every month. So it depends on where it is and how big it is, you have the bleeding and pain associated with that area. So the symptoms really depend on where the lesions are.
Okay.
The majority of women have it in their pelvis, and the hallmark of that is pain. So you can imagine you're having bleeding inside of your pelvis. That's going to cause a lot of irritation and inflammation. And so every month you have these tiny bleeds inside the pelvis, because it's small deposits where it starts with. And then you just get inflammation and scarring over time. On the ovaries, it can bleed into the ovary and cause big blood-filled cysts, they call them chocolate cysts.
Mm.
And it can invade, and it can even look like cancer. I mean, I've looked inside some services and you wonder, you have to scratch your head. Is this cancerous? But actually it's 25, so it's unlikely.
One person on social media had asked, can endometriosis become cancerous?
No, not that I'm aware of. It is often confused with cancer,
Okay.
as I mentioned before. And I've seen cases where recently I saw a patient who, she went in to the emergency room for pain. Doctors are attendants, and when they went in, they saw this mass on her bowel. Thought it was cancer, took out half of her bowel. But it was huge. I mean, it had to come out anyway. But when they tested it, they didn't find any cancer. That was her 10 years ago. She's up and about now. So it can have far-reaching implications depending on where it is.
And sometimes I read something and it said that it can be confused with also IBS.
Yeah, the symptoms, because the hallmark is
What's
present.
IBS? What's
Irritable bowel syndrome.
Irritable bowel syndrome.
irritable bowel syndrome.
Right.
Sorry.
So if your endometriosis has affected your bowel, then you're gonna have symptoms similar to IBS. Pain when passing stool, the wanting to pass stool very often because the gut is just irritated and inflamed. And that's what the patients with IBS, a lot of them, well, diarrhea predominant IBS, they tend to have a lot of pain and bloating, just similar to what happens in endometriosis patients, who have bowel involvement.
So how does it affect women's mental health in regards to pain management? Because we have to go through all of that. Some people, they have pain.
That is a whole topic by itself. That's another Wednesday evening talk about mental health and how chronic pain is impacting on mental health. It's a huge problem. But in general, any person who's experiencing chronic pain is going to have deterioration of their or can have deterioration of their mental health.
Yeah.
If you're in pain for long enough and you can't find an answer,
Right.
then you're likely going to get depressed. If you have pain surrounding an event, like for women is their period every month, you can imagine the days leading up to their period, what's going through their heads.
This again.
Building up for it
The
mentally.
anxiety, it's almost like post-traumatic stress disorder. Where they start having heart racing, shortness of breath, can't breathe because they know that they're going to be in the emergency room or close to in the few days to come. So certainly, and there's a direct link with management as well. If you have severe depression or anxiety, your pain threshold is just going to be low. Not going to be able to tolerate pain. And that comes on to whole functional management of endometriosis. Yes, you may have pain, but can you function? Right?
So, 2 questions from 2 of our viewers. One, how is endometriosis diagnosed?
The gold standard, as in the bar that we use, is surgery, laparoscopic surgery, minimally invasive surgery, where we take a camera, usually in the navel, insert it through the navel, and we identify the lesions, remove them and send them to the lab for histological diagnosis. They look under the microscope and confirm that these endometriotic type tissues are present in the sample. That is the gold standard. Now, we do presumptively make the diagnosis without surgery at times.
Okay.
And it's usually based on the symptoms and pairing it with exam findings and ultrasound.
If you bark like a dog, walk like a dog,
It is a dog.
it's a dog.
Most times.
Most times,
And,
right.
after a while of seeing it over and over again.
You see, you know how it manifests.
Right, you can say, okay, yeah, this does sound like endometriosis. The pain with their periods, the pain during sex, the difficulty getting pregnant, those are 3 things that are common. And they usually have typical exam findings. You may or may not see anything on imaging, which is unfortunate. A lot of patients come and say, oh, but I did ultrasound. It never showed anything. It doesn't really mean anything. I did MRI, they never found anything. That doesn't mean anything.
So those are not safe finding options then?
When you say safe,
Well, it doesn't give you
reliable?
like a definite, reliable.
No, they're not very reliable to rule out
Oh,
endometriosis.
okay.
They're more to rule in and to help with the staging process if you really want to stage it, although that doesn't really make much change in the management. But so if you see like the over filled with that blood in the chocolate cyst, it gets alright, this is more like the endometriosis. But if it looks normal, it could still be endometriosis.
Okay. You mentioned pain during sex. How does endometriosis affect a woman's sexual health?
We should have brought the little model. I should have brought it to show the relationship with vagina and uterus. But essentially, on the pelvic floor, where that is supporting the womb, you can have deposits right there on the floor. And that's essentially the top of the vagina. That's where the penis would hit on deeper penetration. So if there are deposits there, then that area is going to be inflamed and irritated. And you're going to have a lot of pain when the penis reaches that area.
So if you're declining and try to find gold.
Or if you're using toys, whatever it is that you're using, once it reaches that point, it's going to be very painful. And that's the first part of it. What is often forgotten is the second part, where we just mentioned the psychological effect. Right? So imagine every time a woman goes to have sex, she's having intense pain. Whenever the time comes around to have sex, she's going to clamp. She's going to have decreased lubrication, vagina is going to be dry. So not only she's going to have pain on deep penetration, but getting in is going to be painful as well, because she's just not in the mood. Right? And she's not going to want to, she's going to have, they talk about the loss of desire of sex in women who have endometriosis just because they know they're going to be in pain.
I don't know if I'm reaching, but do you think that affects even the prospect of relationship? Because a woman, she feels like because she has this condition, she knows she might not be in a position to please the man the way he wants it, and decide, stay away from relationships.
Have you ever getting into a relationship?
Yeah. Have you ever heard anyone express those kinds of thoughts?
I guess it's more yes, and it's probably based on past experiences. So they had a relationship that went sour because of not being able to have sex, not being able to be intimate with their partner. And so they don't want to go into another relationship because they don't want to repeat of the same thing. So yes, I suppose that's your question simply, yes.
But before we go any further than that, to go back a little bit, at what stage how can you tell at what year can a woman find out that she has endometriosis?
At what stage? When you use the word stage, doctor, it has a very specific meaning. So you're talking about the different stages.
I think stages of life. You're talking like age.
You spoke about, you asked about relationships, right? And then the age of consent was 16. Right. So I'm saying
keep it up.
Absolutely, and you know what, JASL, that's what definitely promoting
how
sex in the right way.
Like at what year or time frame would a woman find out in her life once she's legally able or should be having sex? Put it that way.
Well, it depends on when she starts having sex. Because you remember, the endometriosis is a condition that starts developing around puberty when the hormones start to kick in.
Makes sense.
So let's say the average age, most women around 11, 12 to 13, 14, depending on. So if most women start having the exposure to the hormones around that time, and it gradually increases up until around 16. Most women are, that's what 54, most women are almost finished puberty at that time, some of them a couple of years after. So the pain may start from initiation of the pain during periods I'm talking about. It may start from the initiation of puberty, or it may start a few years after. The average timeline for diagnosis tends to be about, let's speak about 8 to 10 years, 7 to 10 years, depending on where you are in the world, from onset of symptoms to diagnosis. And where you start having sex along that time, I don't know. That is very individual, so I can't really give you a time from having sex. If you started having sex at age 21 and you started seeing your period at 10, then probably the first episode was very bad. If you started seeing your period at 14 and started having sex at 16, then maybe you don't notice until a few years later when the endometriosis gets really bad.
True, because then when you also think about it with the example that you just gave, you don't say we think about the put it this way. So someone from the inner city community
Mhm.
who it's not like their culture to get regular checks. They're probably having period and your period probably just say, oh, it happened. They probably just have one period. You don't get that check. You don't know what's happening. You know what I'm saying? So I asked that question to say, can you tell immediately that this is endometriosis once you start to have your period, or is something that you take a while to find out?
It usually does take a while, and it's not just in the inner city. It is far regional. We have patients from the upper society.
Anyway, I mean nothing by that. So not out there. I mean nothing by that.
Yeah.
But just the,
It's just culturally how we are.
Yeah.
Women are supposed to have painful periods. That is
Right.
what we know as a country. And therefore, whether you're from inner city or you're from uptown, if your periods are painful, then that's normal. And a lot of women just have the delay in diagnosis because of that. Certainly those who have access to healthcare and are more educated, or it's a genetic thing. So maybe their mother went through it before and have the means to check it out early. Then they can.
You mentioned genetics. I was just about to ask you in terms of cause. What causes
I have
endometriosis?
no idea.
No idea.
I mean, we have a lot of theories,
Mhm.
and they're all theories. Nobody knows
No.
for sure. They talk about period backing up into the belly as the most common theory. But we see it backing up in women who don't have endometriosis. So it's clearly not the same for everybody. There's a genetic component to it, so sisters with it, mother and daughter with it. So there may be a genetic component, but we haven't fully figured out the entire gene sequence to it. There is some, it can happen iatrogenically, as in from doing surgery. So you're doing surgery, let's say you do a C-section or some surgery on the womb, on the lining of the womb, some small parts of it get spilled out into the cut. And so you may get a deposit inside the actual incision, and you get this big endometrioma inside there. That's very painful. So every month the cut that they get swells out, like the seeing a period inside the skin, almost. Yeah.
That's definitely a difficult experience.
What are some of the misconceptions or stigmas surrounding endometriosis?
Misconceptions. Well, I find a lot of patients. I don't know if it's related to what they read on the internet in terms of they come into the office and they want surgery to be done to cure the problem. Even though it is, I believe, commonly written that there's no cure for it, a lot of people come thinking that this surgery they get is going to be a cure, and that is still a misconception because it hasn't been proven. What tends to happen is doing surgery for it prolongs the disease-free period, the time at which you don't have any disease there. And if during that period you change your lifestyle and put in some suppression, then you may never have symptoms again. But it's technically not a cure. Because the same way it got there the first time, if you don't know, it can come back again.
Wow. And then another one is that I heard, because Jamaicans, we believe in a thing just like how we believe in a Christ. And you know what I'm saying? Painful period, women should drink certain emotion. Have you ever heard any of those?
Some of them have merit. Some of them have merit.
Okay.
Think about the painkillers that we normally talk about. Advil, Aleve, Cataflam.
These Panadol now work for this now with these stronger things, right?
Most times.
Most times.
So these painkillers, they belong to a group called NSAIDs, non-steroidal anti-inflammatory drugs. So they treat pain by reducing inflammation. You have certain herbs and bushes and stuff that have anti-inflammatory properties naturally. I actually do recommend it to patients in part of their lifestyle changes to consume these foods that have anti-inflammatory properties. So like turmeric, ginger, garlic, these things all help to reduce inflammatory.
Right?
Did that good for so many things, right?
Well, it's true, it does, it has anti-inflammatory properties, and I'm talking about, there are studies done on it, so it's not just what Granny said, as they would say. They actually did look at it and looked at women who are having pain, they gave them ginger, looked at women who are having pain, didn't give them, and looked at the pain scores between them. So it's not as potent as, say, taking a cataplan tablet. But if you can take the ginger in small doses every day, then generally your ability to fight inflammation is going to be better.
Right.
Without having to spend money on expensive drugs with side effects.
So in addition to these herbal remedies, for want of a better term, what other effective strategies are there for individuals with endometriosis?
The strategy is going to be very dependent on the patient.
Okay.
There are several things we can put on the table, but not everybody wants everything that's on the table. So you have surgery, you have painkillers, you have hormonal therapy, you have dietary changes, exercise. Those two, not really optional. You have to do those two.
Dietary
exercise.
Okay.
There's physiotherapy, especially for women who are having pain during sex accident or something like that. Then there's stuff like alternative stuff for breakthrough pains like yoga, acupuncture, even marijuana is good for medicine.
Yeah, definitely.
we know it's a tea.
And I mentioned the psychological part of it. So the psychologist is an integral part for a lot of women. Some women cope a lot better and don't necessarily need therapy, but some women, they come to you half broken, for want of a better phrase, and they need the additional support, whether it is from a licensed therapist or from their pastor or just from family understanding what is going on and showing them support at home. There needs to be some sort of assistance.
I understand. All right, so you
so we mix and match those things depending on what it is that you want.
and depending on each patient. Say food for thoughts. Food for thoughts. You have to give it to us just after dark here. But another question that, because you did also speak about women feeling pain or enduring pain during sex, is how important it is for you or for that person to communicate with their partner in managing endometriosis.
I mean, enough cannot be said about communication in relationships in general. That is one of the cornerstones of a healthy relationship.
Trust.
So where sex is concerned, I mean, a lot of women may be embarrassed about the fact that they are not able to have sex. And so, or they are afraid based on the situation that they're in because they don't want to lose their partner. And so they, instead of communicating that properly, they may come up with reasons not to have sex.
But how many reasons can you come up with?
There are a lot of reasons that you can come up with.
You can use the same headache card every night.
Something wrong.
Even if you bring the Panadol and put on the night table, it can still be there, right?
You
So,
see, that noise, you're sending me outside, It's a different conversation.
I mean, that is also
really-
a possibility, right? That can arise from not being able to be intimate with your partner. And the partner may get frustrated and go outside, and that may cause a whole host of issues. So definitely communicate with your partner what is going on. It's always good to have the couple come in if that is a real issue. If the problem is having pain during sex, either tell them to come in or refer them to a sex therapist.
Right, because I was just about to ask also, what are, some tips that you would give to support open dialogue?
To support open dialogue?
For the endometriosis management.
I don't know, I just tell them, I have to do it, you have to, you have to have the conversation, right? I mean, if this relationship means something to you, then if you really think this person cares about you, then you are almost duty bound to have this conversation, because it's not fair to keep the other person in the dark and then have expectations of that same person.
And not also that, because think about yourself as the woman. I think you would definitely want to have that conversation because you're the one that's going to be enduring the pain, So,
well, unless you just don't have sex, but that is usually what we're trying to avoid. Trying to get them to have a healthy relationship. So, the communication is paramount.
So don't go full way, go halfway, so you don't touch what's causing
I
pain.
don't know if you can, honesty, tell a man.
Well, no, let's be realistic. Because it's never the edge or the,
Never just the tip.
Never just
Never
the tip.
No.
Yeah.
Maybe if we're using toys, it can,
Mm-hmm.
but I don't know about going halfway. That is,
Yeah, I
you
guess
have to have realistic expectations.
Yeah.
So if you go in there now, you're going to end up knowing that the patient is coming back the next day for painkillers. So.
Yeah, they have to get creative together. I guess that's one thing. Get creative and find
If
other
you don't
ways
want to
to.
go halfway, just ensure you have your stash of people beside you. So once that is done, you're
No,
done.
there are several things that we ask. I mentioned physiotherapy.
Right.
Physiotherapy is actually a good tool, especially if they can pinpoint where it is that they're having. Sometimes they can note that there's one area of the vagina that's very painful. And the physiotherapists, not just any physiotherapist, you have pelvic floor physiotherapists that they treat this sort of thing. Ultrasound therapy, electrical therapy, they do manual manipulation. Sometimes it can even help to release some of the scar tissues. People have found a lot of relief where sex is concerned. So a few, I wouldn't say about not bones, but a few treatments with physiotherapy can go a long way. And that's for the deep part. The part about being anxious with sex and the vaginal dryness. Yes, you can lose lubrication, fine. But the psychological aspect of it is what's really going to need to be affected. And that's where the communication with the partner comes in.
Lubricate the mind first.
Right. So if the woman knows that her partner is cognizant of what is going on, and she may be less afraid of him just, ramming it inside there and hurting her. Right?
The next thing I want to touch on, endometriosis, is associated with fertility issues. Talk to us about that and getting pregnant. Can you get pregnant naturally with endometriosis?
Yes, a lot of endometriosis patients get pregnant naturally. In fact, a lot of them, they don't know that they have endometriosis.
Okay.
Right? I've done C-sections on patients who never had a painful period in their life. The periods are great, and you look and see endometriosis all over the place. Right? So, yes, you can get pregnant. It can be associated with infertility, but not all endometriosis patients are infertile. Most of them. I think the percentage is probably close to like 30% of all endometriosis patients have fertility issues. And some of them may be as a direct cause of the disease where deposits are on the tubes and damage them and block up the tubes. Or sometimes just having a lot of endometriosis in the pelvis creates this inflammatory condition that is hostile to sperm and just prevents sperm motility and even egg release. So there are different ways in which it can affect it.
Calvin, we have a question from one of our viewers, and it's for you, Doc. I suffer from endometriosis. I am 44. Is 44 too old to have a baby, and how do I go about getting help?
That's a very loaded question. There's a lot of things inside there. So in terms of getting help, speak to your gynecologist first. I'm going to say off the bat at that age, when I say that age, over the age of 40, I would recommend if you're having difficulty, speak to a fertility specialist. And the reason is not that a regular gynecologist can't help you.
Right.
But if you are already at 40, you need to have an evaluation of how much time are we working and what is the most effective way to have you have a healthy child. Right? I mean, we all have heard the increased risk of getting pregnant at that age in terms of miscarriages and chromosomal abnormalities like Down syndrome. So getting pregnant is one thing, but then the healthy baby is another thing. So a fertility expert will give you that holistic type, getting you pregnant, ensuring that there are no genetic problems, and carrying you to term. That's an expensive route and not available to most people, but if you can afford it, that would be the best way to get help. In terms of endometriosis, at 44 she has endometriosis, she's had it for some time. And depending on how aggressive it is, she may already have tubal damage, damage to ovaries. I don't know the history.
Right.
She may have had surgeries before that if she knows that she has endometriosis.
Right.
So her ovarian reserve, amount of eggs left, may be actually less compared to another 44-year-old woman. So she may think she has 8 years, but in fact it may be 2-3 years. So getting that specialist help early would be the best advice. And not, I mean, if you can afford it. If not, then whichever nearest medical practitioner you can go to.
All right. Have any other questions of your own?
Yeah, I mean, it's all soaking in. It's,
Trust me.
because
Trust me.
even if the mere fact that endometriosis can be in the brain, that's something that's new to me. And
The lungs. The lungs as well.
you have to pass the lungs for the child brain, and the brain. Remember, it come from down there, so reach. So that's what has me, But really an interesting conversation. Really an interesting conversation.
Well, shed some light on this for me, and I guess other persons who would want to know as well. Because you did say that you can have deposits in the lungs. How will that person know, or what symptoms would they have?
Depending on how extensive it is, you may have anything from shortness of breath, because
During
of the
periods, huh?
inflammation during the lungs. The symptoms tend to worsen during their periods. However, if they have long-standing inflammation, then the symptoms may persist outside.
Okay.
Sometimes there's fluid being released through this endometriotic tissue, and they get fluid build up in their lungs and actually have to have drains done ever so often. Sometimes if it gets deep enough, they may cough up. It may get so bad that the bleeding occurs inside the lung tissue and they cough up. So yeah, I mean, one of the biggest advocates for endometriosis in this country, she talks about her story all the time, from Base Foundation, Shauna Fuller. She has pulmonary endometriosis and talks about it freely.
Oh, it's crazy. You just never know. And that's why it is important to celebrate our women, because that in itself is a strength of our woman. Because to be going through that every month, and it can happen before, during, after, it's crazy. It is crazy.
It is, it's an underserved condition, I find. And it goes back to the stigma of not understanding what is normal. Yes, you have a period, yes, it can come in pain, but if that pain interrupts your daily life, then it needs to be evaluated. If you're missing school, if you're going out to the nurse's office every minute because of pain, then
this period you call sick day every month.
right. If you're missing from work because of it, you're losing one, that needs to be checked out. It's not normal to do. Something is off. And even if the ultrasound says nothing is going on, then
Might need deeper investigation.
So how can healthcare providers better support individuals then with endometriosis? You've given that synopsis there, in addressing like their sexual health concerns and needs also.
the healthcare provider, you're talking just doctors or the entire nurses and well, the first thing is going to be health education. So that comes in at the primary level, when patients are coming into the clinics for their vaccinations, and they're going into high school to get their medicals done. This conversation needs to happen. So, okay, little young Mrs. starts seeing her period now, how is it? Just remember that if she's not tolerating it, get it checked out. Don't just keep her home from school and just think it that it's something normal. So that sort of education from the primary care level is going to increase us catching this disease earlier, where it can be treated more effectively. And once it's late, it tends to be very difficult to treat.
Okay, Doc. So we have some questions for you that might not be tied to endometriosis specifically, but in gynecological health in general. So the first one, what are the most common gynecological issues or conditions that women of reproductive age face, and how can they be prevented?
The most common ones that I would see, like, you mean in terms of my experience? It's fibroids. Really. Yeah, a lot of patients with fibroids. The statistics will tell you about almost 80% of women of reproductive age will have some level of fibroid disease, black women.
Black girl, yeah.
Black men.
Wow, that's.
And most of them,
Sitting kind
thankfully,
of
are asymptomatic.
Mhm.
I have lots of patients who come in and say, oh, I have fibroids, I don't know what to do with them. I don't do anything. Leave them alone.
Mhm.
Not troubling you. Your periods last 3 days, use one pad per day. There's nothing wrong. Right? You have 3 kids, you've never had a fertility issue. Leave them alone. They're the size of limes. Right? But then you have those that are really big fibroids that you have to do something about, or really painful symptoms. So fibroids tend to be a big one. PCOS is another big topic. Hormone imbalance, as a lot of women call it. It is probably the most common cause of hormone imbalance, probably worldwide, in terms of irregular periods and associated with infertility as well.
So how often would you then say that women should like schedule routine gynecology exams?
Initially yearly. I mean, depending on what is going on, you can do it every 3 years. So the pap smear, right now, they recommend to be done once every 3 years, and that is a check to see if you have any precancerous cells on the cervix for cervical cancer. The regular Wellman check usually involves a full body examination. So we do a breast examination, pelvic exam for those who are sexually active, and pap smear. So that we usually do like once a year. If your patient is good enough, and reliable enough to do their breast examinations regularly, and their risk factors are low, then you can probably do it every 2 years, 3 years if you want. But for a general rule, once a year you go for a checkup and make sure everything is fine.
Calvin's saying that to all of the dollies them out there, so ensure that you get your check every year. Alright?
Speaking of the dollies, when the dollies them go for the check, them hide them panty back. Is that something doctors care about?
No, we don't care about underwear. I get this comment all the time. Why is it that you're closing the curtains? I say it's for modesty. So why are you giving me a gown? I say it's for modesty. They say, but you're going to be up inside very. Why you need to? I say, well, what you want me to do? Stand up and watch a strip? I can't do that. That is not reasonable, right?
Cross your legs and take it up.
So I close the curtain and let them put on their
Can't wear a Calvin, man.
put on their gown and then you come and do the exam. It's just professionalism. Where you keep your underwear is your business. If you want to wrap it up in your skirt, if you want to put it behind your neck. Some people, I've seen a woman put it behind her back, and it don't matter.
Why would you think they would hide it though? Like, say you do care, why would you think that?
I don't know, because I don't care. So for that, it's underwear. We know you're wearing underwear. Right. So we know you have to put it somewhere. So just put it somewhere.
Then I just see it.
Underwear conversation again. Underwear question again. Panty seat. Stiff. Is that good or bad? Women use that for this one.
It depends on what time of day you're talking about. Some women at the end of the day have a lot of secretions. It's neither here nor there.
Early part of the day.
I don't know why you're panty this.
And bleach out, because bleach out the seat also, is that something?
No, not necessarily. I mean, that has a lot to do with the type of material that's there and where they are in their cycle, but it's not usually a big thing. Some women, they soak their underwear and various things to make sure that it is clean, so it can be bleached out for various reasons.
Oh, so it wouldn't have anything to do with the secretion then? It's just a method of taking care of the underwear.
Most times, or just the material, the type of underwear. Sometimes the material is just, the integrity just goes after a while.
China
So that is the area that is washed most. When the women are washing underwear, that's the area that gets the most attention. So it's going to get worn out faster. I don't know why we're up here talking about panties.
Questions, I'm sure.
I don't see that on the paper. Don't making this up on my head.
Alright, okay. So, the big metal bead.
Yeah.
The women are afraid of the big metal bead.
Oh.
The metal part of it. Yeah.
Is there no other way to examine a woman? And for those who are wondering what we are talking about, we're talking about the speculum.
Speculum,
Yeah.
Interesting, I don't have those in the office.
You don't have those.
I use plastic.
Plastic. But they
and
still
then-
the big beak. Let me see the big
No, they're
beak.
small, they have
They're
small,
smaller
medium,
ones.
and large, depending on the vagina that you're dealing with.
Wait, no,
Let me
wait.
say you might not think the same.
Wait.
Go on, Kevin.
You said they have small, medium, and large depending on the vagina you're dealing with. So
Yeah.
are you saying not that you have small, medium, and large?
You have different size people. You have different size women who have had 10 kids and women who have had no kids.
Mhm.
And so they will require different tools. to examine.
I know somebody who's listening, they had that moment too, so I have to ask a question for them.
No man, I use plastic, one because I don't have to worry about the temperature as much.
Yeah,
The metal gets cold in the AC and that's uncomfortable. And two, it's disposable. They're relatively inexpensive, so you use it once, you throw it away. I don't have to worry about cleaning it, I don't have to worry about finding some place to store it in terms of clean and dirty speculums. I don't
Using
have
the
to worry
special
about
chemical and
special
whatever.
chemicals that may have other effects. So, I prefer the disposable ones. So I don't have that complaint about the metal.
Okay.
So, Doc, you see all the goods, right? Because you're a
We
gynecologist.
call them good, so I see a lot of patients.
You see a lot of patients
Yes.
with the goods.
Yeah.
Right? Should men be threatened by gynecologists?
No, it's work.
Yeah, but it's a woman, it's another man that touched my woman in the
Yeah.
places where me I don't touch.
I use plastic.
I'm making sure that it's good for you to touch. All I'm doing is checks. And interestingly, half the patients that come to the office, I don't have to do a vaginal examination on. I don't necessarily have to do it.
Okay. So you hear that man, then we don't have
That
to
is-
worry.
In modern day medicine where imaging is so widespread and available, a lot of the times the examination doesn't necessarily add a lot to the diagnosis. So we tend to do it for doing pap smears, or if she complains of, I have a discharge and I want to know what is causing it. Then we have to look so we can see what the infection is, so we can, make a diagnosis and treat it. But most times with ultrasounds and MRIs and those things, we don't get a lot of extra information from doing a vaginal examination. No. So back in the day, you'd have more of an issue, but nowadays it's not as invasive.
Are there any misconceptions about women's health that you encounter in your practice?
I guess I see a lot of pelvic pain patients. So I get a lot of the stories of I've had pain for so long and I was told that this is normal. I've gotten patients with fibroids who are told that they can't get pregnant because of their fibroids, which is largely untrue. And it affects couples sometimes where a woman has fibroids, is trying to get pregnant with her consort or husband, and the consort refuses to do any investigations because she has fibroids. When the truth is, most fibroids don't cause fertility issues. It can be associated with miscarriages sometimes, as in can lose a pregnancy, but for it to prevent pregnancy is not a common occurrence. But a lot of women, they always think that they're the problem. So whatever thing they find wrong with them, it must be them, but it must be that's causing the problem. Yeah, so but male infertility is a bigger issue than we acknowledge.
Not that coming from a man to them. What is true? What is true?
It's a bigger problem. 30% of infertile couples, the man has an issue. That's 1 in 3.
So that means a 70 woman? But that's not a little maths. But that's not a little maths.
You have 30% where the man only.
Man only. Okay.
Right.
Okay.
The other 70% is man and woman plus woman only. I don't remember the exact figure for the man and woman
Okay.
together.
What's the
But
fact
it's,
about 30%?
but 30% is still
that's a lot.
significant.
It's
a lot.
I mean, you should have no hesitation to do a sperm test if you're with your partner and both of you cannot get pregnant. It's not she can't get pregnant, it's the couple can't get pregnant. And that is an important distinction to me.
Definitely. So when she get pregnant, it's not, oh, she's pregnant, it's we're pregnant.
It's we, it's always we.
Yeah. Speaking of we, me and my partner, I don't know if it, well, let me not say me. different relationships, you know, different sexual appetite that a male or a female might have. Can sex be too much?
That's a compatibility issue sometimes. Because
So that means there's nothing biological to say sex can be
Be
too
too
much.
much.
Then.
okay, medically speaking, if you desire the need to have sex to a point where it is interfering with your daily activities, you're not working properly, you're destroying your personal relationships, then you're an infomaniac, and that is an issue. Most men don't fall into the category, they just love having sex, and that's fine. Some men more than others, and it just sometimes doesn't match up with their partner. And that's what usually causes the disconnect and the cussing and fighting about, you know, how often they have sex and that sort of thing. But to say too much, it would have to be disrupting something.
Something, okay.
So if it's not, then you're still within normal. I mean, your friend is still.
So long and short, Doc said no.
Yeah, so question Doc. So are there exercises or treatment that can actually prevent or help prevent or manage pelvic floor dysfunction? Can a woman actually do something to make it get tighter?
Yes, I mean, Kegels exercises is a common thing that they advise. I mean, it's usually after pregnancy, after delivering, they advise pregnant women to do it to help return the tone of the vagina. But it can be used by non-pregnant women if you never had a kid and you want to maintain the tone or help reduce the risk of it becoming too lax after pregnancy. Then you can start doing it from before. It's just like any muscle. If you exercise it, it will get stronger. And similarly for women who are strength training before pregnancy, they have less back pain during pregnancy and they bounce back in shape better after. And that's just a matter of them being active and having more muscle mass from before. So similar in the vagina on a smaller scale.
And how do you approach discussions about LGBTQ plus health and reproductive options?
I mean, in my practice, I see we have lesbians, bisexuals. I've not come across any transgender in my office. But they're no different. They're women, biological women. I mean, I know the terms can be very gray these days, but biological women. So they do their regular checkups, pap smears as indicated, breast exams. The only difference is when it comes on to the talk about contraception, because if they're having same-sex relationships, then it's not really an issue. If they're bisexual, then yes, we have to have that discussion still. In terms of getting pregnant now, that I usually refer to the fertility specialist. It often involves donor sperm. But I mean, sometimes these women, they find men willing to donate sperm without going to a lab. So you allow women to make their own choices and decide how they want to get pregnant. And once it's safe and there's no infection on board, the body gets screened before the process, then
Just sell it.
We're in our final minute, Doc. So last question before we wrap up. How can STIs affect a woman's reproductive health?
well, that is probably the second leading cause of infertility in this country.
Understand?
I don't know if it's second or first with endometriosis. It can affect tubal patency, can block the tubes. Chlamydia, gonorrhea, those things can block the tubes and impact their ability to get pregnant. That's probably the biggest.
Okay, there's a promotion you want to tell us about.
I do.
Yes. Go ahead.
Oh, you mean for my thing?
Yeah,
Right, so for the month of March, we've been doing a special at the office where patients who come in for pain consultations, we try to reduce the cost of accessing care, and we include a free pelvic ultrasound. I know it's not great for most things, well, for endometriosis, but it can pick up other things and eliminate that step that a lot of patients have to go through. So we do the consultation, we do the ultrasound in office, can have an idea of what is going on and start the road to recovery.
Where can they find you at the office?
My office is on Windsor Avenue, street number 222 Windsor Avenue, Kingston 5. That's around from AC Hotel.
Okay, okay. Well, Dr. Ryan Halsall, thank you so much for joining us tonight for
Thank
Just
you
Love
guys
the
for
Dark.
having me.
Yes,
Yeah,
I feel like some brain grew up.
Sure,
Learned
yeah,
so
that's a
much.
lot, yeah.
I was
Learned so
trying
much.
not to be too medical, but
Yeah, man.
sometimes, I mean, it's a topic that requires a lot of support and a lot of exposure so that we can get these girls in a better state going forward.
Yes, yes, yes. So I want to thank you for coming and sharing with us your wealth of information and expertise tonight on Just After Dark. Yeah, the place where we can't talk about after day. In the day rather, we talk after dark. But I want to remind our viewers that Jamaica Aid Support for Life, we provide free HIV and syphilis testing, and if you're found to be living with HIV, we do provide free HIV treatment as well. And we also provide PrEP, that one-a-day pill that reduces your chances of contracting HIV, all here at JASL, so you can follow us on our social media platforms, reach out to us, send us a DM, and you can book those services with us. Anything to say, Jamar?
Thank you for watching. You can follow me on I am Jamar on Instagram. If you want to see me at Creative Class, I'm over there as well, Creative Class 876. And if you want food to eat, I'm at Shaman's Kitchen. You can definitely check me out there. And if you want information, I'm so many places. Just After Dark is the place to see me.
Yeah, alright. So, next week, same time, 8 o'clock, Just After Dark. Thank you so much for watching.
Take care.
Yeah.